Welcome to MIdLIFE Matters, where we celebrate women's wisdom and wit. I'm Georgianne Lucier, your host, and I'm delighted to introduce today's guest, Dr. Timothea Ryan. She is an ophthalmologist who specializes in glaucoma and cataract surgery and also specializes in other eye diseases. So welcome.
Thank you. Thanks for having me.
So you do have all these other eye issues that you deal with, including macular degeneration, the diabetic retinopathy, and I know you use innovative techniques as they come along. We've talked about how technology changes. So as this is a show for midlife age women, I'd love to hear what you believe to be our typical eye changes as we age and what things maybe are more genetic-based versus lifestyle-based, just what you tend to see in your studies and your practice.
One of the most common conditions that we get as we age is cataracts. Cataracts are just normal part of aging. The more and more people do need cataract surgery in their lifetime. It's one of the most commonly performed surgeries world, basically. The most common surgery I do. We are doing cataract surgery earlier and earlier because people are living more active lives and living longer. You know, there can be certain conditions like actually diabetes that you can get cataracts a little bit younger, but again, that's one condition that's very common and normal to aging. Surgery is needed when people need to see better. If the cataracts are in the way of their vision, the surgery is a very safe and, painless short surgery that can be done to improve vision.
What age typically do people tend to start seeing effects of cataracts?
Typically 60s, 70s.
Okay.
It would be unusual to need surgery in 40s and 50s, but it does happen, particularly diabetics, or other eye conditions like an injury, prior injury or something like that. A lot of the most common eye conditions that do tend to show up mostly in middle age or older age are a combination of genes and environment. So there's several genes, some of which haven't even been worked out, that if you inherit the right combination and some environmental effects, you get the disease. So another common disease with aging, you mentioned macular degeneration. So that tends to affect people even later than cataracts, more in their 70s, 80s, even 90s, it can show up. Some of certainly a genetic component. So a family history of that makes it more likely that you will get that. Having a certain shape to your eye, being farsighted rather than nearsighted, being Caucasian rather than Hispanic or Black is more common to get macular degeneration. But the environmental things are smoking is a big component. Probably there's a dietary component, eating more. A Mediterranean diet is protective against it. Some effective sun exposure, so high sun exposure. Smoking and family history are the biggest risks for that.
Explain again, farsighted, nearsighted. Isn't it kind of reversed to what you think?
Nearsighted, you can see near, and you need glasses to see distance.
Yeah.
Farsighted, usually you can see distance pretty well. And you need glasses for reading, for up close.
All right.
Yep.
So best practices would be for people to have regular eye exams.
Yes, that's the sneaky thing. A lot of these common diseases that affect either middle age or older people, in the early stages, they have no symptoms, no pain, no vision changes, but they can be just brewing. So they can be picked up early and treated, addressed early on a regular exam, which usually includes dilating your eyes. So making your pupils bigger with drops so I can see, your optic nerve, your retina, your lens for a cataract. That is recommended after 40. Even if someone, again, doesn't even wear glasses, doesn't have any symptoms, no family history, just every couple of years have a full eye exam because those things can be found.
How long have you been in practice?
Almost 17 years in private practice.
All right.
Yeah.
And what changes have you seen? Technology and, conventional wisdom may be disputed.
One of the biggest things that's, just speaking to this population, some of the disrupting things that have been amazing, basically treatments for macular degeneration, which affects so many older adults. Luckily doesn't completely blind you, but it can lead to legal blindness. When I was in training and residency, there were only treatments that could basically keep it the same, if it even did that, laser treatments. But there were no treatments to make people better. Now we have, it was just being started when I was in residency, and now this has become the mainstay of treatment is medicines that are given right to the eye that can actually improve vision. So definitely slow it down and oftentimes improve vision. So that's really been game-changing for so many of my patients who sometimes have multiple conditions that suffer. In my field of expertise, my subspecialty, less invasive glaucoma surgery. It's called MIGS, minimally invasive glaucoma surgery. When I trained, we didn't have a lot of these types of surgeries. Glaucoma surgery for more advanced cases was a very big undertaking and very risky. Similar to if you think about getting your appendix out or your gallbladder out with a huge incision.
Right.
Now we all go through tiny incisions, quicker healing, less pain, quicker visual recovery, and they're effective. They're effective, especially in the earlier stages of the disease. So that's really been game-changing as a glaucoma specialist, to offer more of this variety of options for my patients rather than saying, you need this major surgery. It has a lot of risks. And patients, even though they know they're maybe actively losing vision, they don't want to take those risks. So,
how do you stay current when there's changes? Do you go to practicums or something?
I usually go to one away meeting conference a year. Common one, there's American Glaucoma Society that I'll go to, or American Academy of Ophthalmology, and the specialties, Connecticut Society of Eye Physicians. I'm actually speaking on a panel about staff issues in June. So they have a twice a year full day meeting where they bring in speakers from all over the country.
Okay.
That all earns us continuing education credits.
Right.
And, to maintain your license, you need a certain number of credits. But you could certainly never leave your house and do these, with obviously, internet. There's webinars, there's online CME. Certain books, can have, some credits involved with them. Most of the major meetings, especially American Academy of Ophthalmology, to learn techniques, there are hands-on workshop skills transfer sessions. Done a few of those. Interestingly, a lot in the glaucoma world and the cataract world, the basics are there from residency, like the basics of cataract surgery, the basics of the major glaucoma surgery. But some of the newer technologies, believe it or not, it is a representative from the surgical company who's not a surgeon.
Oh, I can believe that.
Who actually sits with you in the OR, not with like a fake patient eyeball.
Right.
And you learn it. And again, some of it, the skills you already have, some of the basics for it. And they may go... In a week, they may meet with 10 different doctors and go to 10 different ORs. And so they really see, They really have, even though they're not a surgeon. So it's kind of interesting that, but, some of the surgical reps are great and supportive and really do a wonderful job in, helping us learn these new
they
new
have
techniques.
The practical application end of it. They don't necessarily have all the learning,
the medical background.
Right. But once you get to that point, they know how it's supposed to be used.
Exactly.
Wow, that's a very big career. Obviously, becoming a person with your credentials requires training and education in different schools and settings. So please walk people through what your process was like.
Ophthalmologists, we all go to medical school. Before that I went to 4 years of college, graduated from Cornell University, and then 4 years of medical school. I went to University of Pittsburgh. And then you have to do a residency for any specialty. Most ophthalmology residencies are 3 years, but that doesn't include an internship year. So I did a general medicine internship year, and then 3 years just focused on ophthalmology training.
Okay.
And then I did an additional year in glaucoma fellowship. That was 1 year long. And so it's a long time of training, but it's wonderful opportunities and learning. So.
And so it sounds like you did have 1 year where you were dealing with different body systems.
Yes.
That's well-rounded.
In medical school, you get exposure to everything. Ophthalmology is a little weird because you do this sort of transition year. But I think it's important because even though it's a surgical subspecialty, we see diabetics, we see rheumatological patients, we see, all sorts of, so we had kind of exposure to all that.
Yeah.
Okay. Yep.
So I just heard a story. Your mom's here in the studio.
Yes.
And she told me that you, at age 9, expressed interest in becoming. So tell us what the circumstances were that was that aha moment for you.
I really liked my optometrist, actually. I wore contact lenses because I did gymnastics at a young age, and it was difficult to wear glasses, so I was probably one of his youngest contact lens wearing patients, and I was a success. So that kind of got me interested in the field. And then I think another thing that clinched it for me was when I was in high school, my grandmother would drive me to dance class sometimes, and it was after dark, and she would always drive very, very slow everywhere, just in town. And she kind of ran off the road, like couldn't see the curb, and ran into some bushes. No one was hurt. The car wasn't damaged. It was just, she had a hard time seeing at night. If we find out she had cataracts, and she had the surgery shortly after, and she could see 20/20 and drive well at night again. And it was just amazing to me that such a simple surgery and how, it brought back her vision. So that also kind of motivated me to go into ophthalmology.
Wonderful.
So, yeah.
So getting these medical credentials, you have to have high levels of scientific aptitude, skills, certainly the hand dexterity and everything. I mean, it seems like there's kind of a magic mix, right?
It's a competitive field. It's a good lifestyle, ophthalmology, fairly good hours, high-tech things, very interesting. I actually loved general surgery. I loved all the big surgeries. That's a very challenging lifestyle, especially if you want a family.
Okay.
So, not that, ophthalmological surgery isn't amazing.
Yes.
And it is very microscopic
Right.
and precise. I think it's the best combination. I get to know my patients long term, get to help them see better, use pretty neat high-tech stuff. So it's just a great, there's really not a lot of downside. It is competitive because of that.
So how did you discover that you had that mix, that your capacity for, being a biology major, all the science, also having the aptitude to work with, fine movement and so forth?
Yeah, I think I enjoyed assisting in surgery. I mean, in medical school. So I thought, I do want to do something hands-on. Interestingly, while you don't major in anything in medical school, I was a biology major in college.
Right.
We had concentrations, and I was a geriatrics concentration.
Okay.
I knew I wanted to work with older adults, and my mentors thought there were about 6 of us that were very interested in geriatrics, and about 5 out of the 6 of us ended up becoming ophthalmologists. In medical school, you don't get to do the surgeries, but you get to maybe, assist a little bit and with the attending. And so I just felt it was the best combination for me of working with that population, because ophthalmology has the second highest population of older adults.
I would think so, because
to geriatrics, just because of the disease.
Yeah, just over time.
So it just fit. It just fit
and you were
really
able
well.
To do it.
And and I know I have steady hands. I always liked. I was kind of in a little knitting club in medical school. It would be kind of funny. We'd be in lectures and we would be paying attention to the lecture, because you can knit and listen and even stop and take notes if you have to. And at one point, the professor looked at the whole front row of us all knitting. He goes, "Oh, you guys are all making things," and so I knew I had the manual dexterity to do it.
Yeah.
So. Okay. But it still takes, years of training to learn.
Yeah, I would imagine. And your hands are
Yeah.
really important.
Yeah.
In terms of not having injuries and so forth, right?
Yes.
You have to
yes. My hands are insured.
Yeah, I bet they are. So who cheered you on through all of this?
My first motivation to consider medicine, I always liked biology and science. And I thought I would be maybe a biologist or environmentalist or researcher, but my AP biology teacher senior year in college, my parents taught at my high school too, and he really cheered me on to pursue medicine. I remember we did a demonstration in the school library, a science fair, and I had a cow heart that I got to show off. And I remember showing everybody the parts of the heart and the chambers and how fun that was. And I said, this is, in medicine, so flexible. You could teach if you want, you could be a researcher, you could see patients. My mom was always a big champion. She always worked hard. She always had a full-time job growing up, and she just, she always, both my parents always.
So you had educators as
parents. They were both teachers.
Yeah.
They both encouraged me. And then this sounds really crazy, but I had I think medicine, it takes some toughness, just mentally, just hours-wise. I competed competitively in rhythmic gymnastics growing up, and I had a coach. She was a huge inspiration to me. She was not only a gymnastics coach, she was a police officer. She did hair on the side, hairdresser. She was a mom. She just was a hardworking lady, and she pushed me. I mean, tough love. She pushed me to be competitive and to be tough, and I had to go in front of judges. And like, I think she's part of who made me who I am and motivated me to strive to be who I am today.
On your virtual profile, you talk about enjoying yoga, reading, cherishing family time. Are you still doing knitting?
I am not. I never really advanced. I could make a scarf, a hat. I have not knit. Okay. No. Still practicing yoga.
All right.
Love to read. I mean, things, family time, all that. Yes. Right. No, okay. I have not kept up the knitting.
Women do struggle to have it all, if you will. I know you've already reflected that some of your choices were taking into account that you wanted to be a family person, to have your own family. And so what has worked for you? I mean, your choice of occupation was thoughtful.
I've been very lucky. My husband, he's retired now. He's a little bit older than me. He was in his own law practice. So his schedule, even though he was in court and lawyer, his schedule was definitely more flexible than mine in terms of having kids. I mean, we both did work full time, but he could be a little more flexible. And he was great with the kids and helpful with the kids. So that was a huge help. My parents also nearby, watched the kids when they were little before they started like preschool and school. So obviously it takes a village, and those were huge. And then I always say if you can swing it, I mean, this is the best. It felt at first a little bit splurged to me, but the first day I had a housekeeper come to my house and clean my house, and it was like, every couple of weeks, literally changed my life. It's one more thing off your plate that you don't have to clean your whole house and think about it. And it's worth, to me, every penny. It sounds really weird, but it's the best decision I ever made in my life.
I've had a cleaning person at different points, and that is.
And so many women, they beat themselves. Oh, I'm having company over. Or my house doesn't look laundry. And no, just if you can do it, do it.
Yeah, get some help.
It's the best. Yeah, exactly.
Get some help. You had mentioned to me one time that you'd gone on vacation with a girlfriend. So how have women's friendships affected you in terms of providing the support you need as different things come up in your life?
I'm actually a cancer survivor. Okay. I'm a breast cancer survivor. One of the facilities I operate is Hartford Hospital Eye Surgery Center. When I was home on medical leave, the nurses, every day I've got in the mail multiple cards, letters, gift cards. I mean, literally they didn't stop coming in. And I think in addition to patients, praying for me, thinking of me, family, friends, those nurses, I mean, you know what I mean? We need to value our nurses so much. They're so amazing. And they've been a huge part of just, making my operating days run smoothly and just loving, to be doing the surgeries I do. And that helped when I first moved back to Connecticut from all my schooling. I joined a book club with girlfriends, and everybody was sort of having babies at the same time, and we bring them to the book club and the little carriers, and that was nice to just have that support network. I have a good friend right now. I just saw her earlier who's a nurse, so we kind of commiserate around, healthcare, and she works at Yale and the craziness. And now I own my practice. I'm now part of Refocus, which is a larger, private practice. And there's a lot of women in Refocus, and I've actually gotten to know a lot of the other women ophthalmologists, which when I was in private practice, I had 3 older male partners. And they were great. I had a great mentor who was wonderful as a business partner and a colleague. He's a much older man, not as much in common. So now it's very nice. I have a colleague within my own office that I see every day that we've become good friends and support each other a lot. And then also within the larger group, there's a lot of women that have been wonderfully supportive. So I think you got to find your people, and I've been lucky to be able to find them. Yeah,
absolutely. Yeah. So what advice would you give your younger self, like at 25 and 40, or 40 wasn't that long ago for you, but, your earlier days, and then as you were getting a little bit more into your career?
Maybe at a younger age, don't be so boyfriend obsessed. This sounds silly.
No,
you know?
I'm with you there.
Cherish friendships.
Yeah.
I mean, I always was blessed to have good friends too and everything. You said also look for what to tell your 40-year-old self. I'm only 23, so I don't,
Right,
that's
right.
going forward. No, 40 and even now, go out dancing more.
Nice.
You know what I mean?
Yeah.
Like dance like no one's watching
Okay.
and dance more and go to more concerts, more music shows, dance at the concert.
Enjoy yourself.
Yeah, exactly.
whatever it is.
You don't outage that. I'm
Yeah.
reading a book right now about a 72-year-old woman visiting the island of Ibiza, which is like a party clubbing island. It's an interesting book. And the chapter I just finished, she's out at this she goes out at 2 a.m. and she's dancing among all the young people and some older people.
Right.
And they said age doesn't matter. Just go out and have fun and don't
Nice.
don't worry about age.
Okay.
So
And do you have a favorite quote?
this is actually from Anthony Bourdain, who unfortunately we've lost, and
Right.
I miss him like a dear friend. I loved all of his shows and books. And it's eat at a local restaurant tonight. Get the cream sauce. Have a cold pint at 4 o'clock in a mostly empty bar. Go somewhere you've never been. Listen to someone you think may have nothing in common with you. Order the steak rare, eat an oyster, have a Negroni, have two. Be open to a world where you may not understand or agree with the person next to you, but have a drink with them anyways. Eat slowly, tip your server, check in on your friends, check in on yourself, enjoy the ride.
Wonderful. Thank you so much.
Welcome.
And please tune in to hear other fascinating women and future segments of Midlife Matters. I'm Georgianne Lucier, your host, and thank you for joining us.